With amino acids, various types of amino acids are very popular for supplementation. First thing to understand is the difference between the essential and the non-essential amino acids. So the essential amino acids are those that cannot be naturally synthesized within the body. In other words, the essential amino acids are amino acids that you need to take in from your diet that your body can't create on its own. So the essential amino acids here are listed, and we're going to talk about, again, we'll discuss also the non-essential amino acids, but we're going to talk about in what forms these different amino acids typically come in when you look at supplementation wise. Here are your non-essential amino acids. Again, these are those that can be produced by the body. Some are, you will commonly see sometimes out there marketed supplementation wise. Probably some of the more popular ones on this list that you'll see, arginine, tyrosine, and taurine are very common amino acids that you'll see available for supplementation. These are the non-essential amino acids. And this is the rest of the non-essential amino acids. One that you can see is kind of highlighted there. Histidine is actually considered an essential amino acid in children. In adults, it's considered a non-essential amino acid because it can be produced by the body. But in young children, histidine is considered one of the essential amino acids. So in looking at how a lot of amino acids are marketed, what typically when you look at the amino acids and how they're marketed for supplementation is there's two things they look to promote. They look at from the muscle building perspective, so the recovery and you know, from the strenuous strength training workouts, and through the carbohydrate sparing, meaning almost providing an energy source and providing carbohydrates, allowing them to remain as an energy source for later on in training. Another one that you commonly see a lot is glucosamine, which is particularly marketed for articular cartilage repair. And this is a very, very common amino acid that you see marketed for this purpose. One of your common supplementation forms of amino acids here are the branched chain amino acids. So again, these are marketed particularly to people who strength train to help in recovery from muscle. These are all essential amino acids. So the branched chain amino acids that we look at are valine, leucine, and isoleucine. So this is a group of amino acids that together again are marketed for that muscle recovery aspect. One of these in particular, we'll talk about the nature of research done on branched chain amino acids. Leucine is actually one that has shown a lot of benefits, particularly for those who strength train. We'll talk about here in a little bit the actual branched chain amino acid supplements and how they work. So in looking at what branched chain amino acids actually do, so they can be oxidized during exercise for energy purposes. They can provide an energy source for the actual exercise or the activity being produced. They can help in reducing exercise-induced muscle damage, so there's a recovery component there, and again can enhance post-exercise muscle protein synthesis. So again, if you think about strenuous strength training and what happens as a result of that, the branched chain amino acids can help in that recovery and repair process. Another thing that's looked at with the branched chain amino acids is they compete with the amino acid tryptophan for entry into the brain. What was kind of hypothesized with this is that if the branched chain amino acids compete with tryptophan as far as entry into the brain, is that they can help to limit potential fatigue caused by tryptophan. Studies have found this not to be the case, and even in some studies where people were actually given tryptophan, that it didn't necessarily influence their exhaustion. So as far as the benefits, it's questionable as far as whether the branched chain amino acids really do give that great of a benefit, particularly if the diet is sufficient. So the idea here is that if you're eating meat and you're getting through your food sources, you probably don't need to supplement with branched chain amino acids. So just to kind of show here, so again, the research is mixed. There's not really, it kind of goes back and forth on the evidence as to whether branched chain amino acid supplementation is really needed. There's some that show a bit positive effect with exercise, some that don't. One of the potential concerns is that with the breakdown of branched chain amino acids, high levels of ammonia are created. So for people that have liver and kidney disorders, it's usually recommended that they do not supplement with branched chain amino acids. For everybody else, they are a pretty safe supplement to go with. Again, the question becomes, are you going to really get benefits from the branched chain amino acids? Is very questionable. Now, I had mentioned earlier about leucine. Leucine is actually an amino acid. It is one of the branched chain amino acids, but by itself is actually, we have here considered the key essential amino acid, that it shows that there have been some positive benefits with leucine supplementation. In particular, when you have create an environment where there's insulin and leucine present, you see some of the potential benefits here that have come about. So, together insulin and leucine allow skeletal muscle to coordinate protein synthesis. So it basically allows the body to utilize the dietary intake of protein to help regenerate for instance, if you're again we look at this from the perspective of strength training, allow for muscle recovery and protein synthesis to take place. And if you just read the slide, you can see some other benefits that have been found with supplementation with leucine. So leucine is definitely a supplement to consider for performance benefits. Glutamine is another amino acid that you commonly see supplementation-wise. It is thought to promote an anabolic state in muscle. So again, much like a lot of the other theories behind amino acid supplementation, here you have again another situation where, for protein synthesis, potential benefits here. It is not considered an essential amino acid, and again, what we're seeing with some studies with glutamine is that there is the potential that it may help with muscle repair. So again, you look at strenuous exercise, the recovery aspect, there has been some benefits shown with glutamine. Now, you may hear some people consider glutamine to be a conditionally essential amino acid. However, overall, when you're looking at the essential amino acids, it's typically not classified as one. The primary source of glutamine is the skeletal muscle, and it's utilized as a fuel by other tissues. And when you look here, one of the things we're going to talk about is that the potential for it to reduce infections, and that's where its function with the immune system comes in, but it is utilized by other tissues in the body to assist in their functions. Now again, here we look at the potential for glutamine through its impact on the immune system to help reduce infections in athletes. So obviously athletes, particularly during times of strenuous training, can put themselves at risk for infection because of their immune system being suppressed. So, one study that was done, as we have cited here, showed that it did have the potential to reduce infections. So they gave 5 grams immediately and 2 hours post-exercise, and they compared it to a placebo and did see a slight reduction in infections in athletes. Now here's kind of some of the catch with glutamine, that overall there's not enough evidence shown that it reduces infections, particularly with healthy individuals. Most of the research done is with individuals who have HIV and cancer patients. So, in these individuals, these are people who are, immunocompromised because of their condition. So they've shown benefit as far as being able to maintain body weight and muscle mass in those particular types of patients. So there's not a ton of research done on healthy individuals and having a benefit with glutamine. Probably one of the more popular supplements that you're going to see and very commonly used is whey protein. So you look at whey protein, and first of all, what is whey protein? Well, a lot of the reasons why people use whey proteins, it's a fast-acting protein, and it's considered to have a much higher percentage of branched-chain amino acids. And again, it's, anytime you're ingesting any type of protein, the idea is to, again, increase the repair and be able to, again, augment the benefits of a strength training routine to help in the increased size of the muscle. So by taking in the whey protein, it helps with that. It helps with muscle repair and the recovery when the individual is not training. Again, we're looking to point out kind of facts here and point out things that aren't true. So one of the myths is that excessive protein intake will damage the kidneys. There's not one definitive research claim that supports this. So when you look at those, when you see the research that shows this, most of the changes are occurring in individuals who already have kidney dysfunction. So for healthy individuals, increasing protein intake is likely not going to cause any damage to their kidneys. So this is one of the myths out there as far as, well, taking in excessive amounts of protein is going to damage your kidneys. In a healthy individual, this is not going to be a concern. Beta-alanine is another supplement now that is becoming very popular. It's an amino acid derivative that is synthesized in the liver. The big benefit to beta-alanine is it increases carnosine. Now, carnosine is a dipeptide that's very plentiful in the skeletal muscle. It's also in pretty high concentration in the brain. The benefit of carnosine is that it helps, again, with high-intensity exercise. And you see this naturally in individuals who are in strength and power-based athletic activities. So it's an interesting supplement that has shown some benefit due to the fact that it can potentially increase the levels of carnosine. Now, what this has led some people to think is that you could then just supplement with carnosine. However, it's not shown to be as benefit to supplement just with carnosine, because when you take it orally, it gets broken down in the stomach and then it's not as effective. But the beta-alanine can increase the concentrations within the skeletal muscle. So again, a very good supplement that has shown some benefit. So we look at a supplementation routine. They look at 3 to 6 grams of beta-alanine per day, at least 14 to 28 days. Can help with that intramuscular carnosine. The other thing that beta-alanine can do is help delay fatigue. So, again, when you experience the fatigue in your muscles, particularly that burning sensation, the reason for that is it's actually the hydrogen ions. So people always attribute it directly to lactic acid. While lactic acid does accumulate, it's actually the hydrogen ions that produces the discomfort. So the idea here is that another thing that beta-alanine can do is actually buffer those increase in hydrogen ions and reduce that fatigue. Erythropoietin alpha or EPO, is a blood product that actually increases the number of red blood cells. So if you remember from anatomy and physiology, the red blood cells are responsible for carrying oxygen throughout the body. So the thought process here is, if you increase the number of red blood cells, you're going to increase the amount of oxygen being carried to the muscles, and therefore increasing the endurance within the muscles. It is actually a prescription medication used for chemotherapy patients. So this isn't actually an over-the-counter supplement. This is actually a prescription medication, again used for medical purposes, but athletes have used it to improve performance. The old technique that used to be done was what was called blood doping. And what athletes used to do with blood doping was they used to actually take blood from their own body. They used to take it out and then have it re-injected to increase their overall red blood cell count. Now again, while that sounds like a good thing and does theoretically provide advantages, one of the major issues is that if it causes the red blood cell count to go too high, it could actually lead to heart failure. So that's something to keep in mind. This is a banned substance. However, it was very difficult to detect. A lot of the governing bodies have gone through great lengths to get laboratories to be able to do testing for this. So that it does provide a mechanism to increase endurance. However, the possible side effects and issues from it certainly outweigh any of the benefits. And then looking at your nitric oxide based supplements. So nitric oxide is a messenger molecule in mammals. The main benefits that come out of nitric oxide are the cardiovascular health and liver health. There's a lot of research done on this, but it's done on plants. The big thing that nitric oxide does in the body is it helps to reduce smooth muscle contraction in the blood vessels. So it actually causes the blood vessels to relax. So what we're looking at here is there are a lot of supplements out on the market that promote the increase in nitric oxide in the body. So we're going to look at what those supplements typically contain and talk about, is this mechanism really that effective for the purpose of exercising and performance enhancement. So the thought process for nitric oxide in relation to the performance enhancement benefit, again, nitric oxide in the body does provide a mechanism, again, for blood vessel health and what have you. The theory with a lot of these supplements that you'll see is that you get improved blood flow and that improves the muscle pump, okay, which, it gets debated back and forth, how much, a pump in a muscle through strength training really, is beneficial. However, the research on the effect nitric oxide has on it, so in other words, you can get if you go and you do a moderately high repetition set of an exercise, you get that sensation in your muscle when you're done. The nitric oxide is supposed to enhance that. The research on the supplements that are marketed for this purpose is very limited, and there's no real evidence to show that the actual nitric oxide phenomenon actually happens and is beneficial to an individual. And obviously this would mostly pertain to individuals who partake in strength training. Now, for the purposes of individuals taking these supplements, they do seem to work, but the interesting thing is, if you notice, all the products that seem to work contain other things that have proven and have shown that they could possibly have benefits. So most of the nitric oxide-based supplements, if you will, or that market themselves as increasing nitric oxide in the body, contain amino acids, and a lot of them actually have beta-alanine in them, which we already know is an effective supplement. They all have creatine, and they all have caffeine in them. So we know that all three of those are beneficial, okay, in some manner to an individual, again, particularly those who are undertaking strength and power-based activities. So the thought process isn't so much that it's the nitric oxide in the actual that the supplement supposedly produces is what helps with the training process, but it's these individual 3 supplements that they usually contain that actually provides most of the benefits. And again, you're looking at amino acids, creatine, and caffeine, all of which, again, have shown some pretty promising research, particularly, leucine being an amino acid, and the amino acid derivative beta-alanine, which, as I said, is in a lot of these supplements as well. So that concludes the entire discussion on supplements. Just to provide some practical points for you as an athletic trainer, you need to be able to, again, educate athletes on these different supplements. People always say, well, are you pro or are you anti-supplement? I don't think you have to be pro or anti. I say, be for research and be for evidence. If there's evidence that shows that something works and that it's safe, then there's nothing wrong with trying it, okay? If, however, it doesn't work, then, obviously make them aware of that. So, again, stay away from, a lot of the myths. I mean, if there are bad side effects to things, obviously you want to educate people appropriately, but at the same time to just say, well, I'm anti-supplement or I'm pro-supplement, I think is kind of a dangerous thing. So, and again, certainly constantly evolve with this. Research is always being done. So, at some point, I'm sure this information could even become outdated at some point, depending upon what research you find. But what I tried to at least present here is at least what's current that we're looking at with a lot of these supplements. And a lot of this was to complement some of the information in your textbook and talk about some other supplements that weren't included in there.